Hey guys, and welcome back. If this is your first time here, I'm Nurse Alyssa, and today I just wanted to kind of go over what I do and what services I provide to you guys. Now, yes, my channel, I have so much on here about wound care. I am a wound care specialist in Ontario, and that's really what this channel is about, is providing you guys with a way of, either if you're a nurse, just a form of education, or if you have a wound yourself, giving you a good grasp on what you can do to heal your wound. But I did just want to share with you because sometimes, and I do know a few people have mentioned that they didn't actually know that I provide online wound consulting. So what can you expect out of a wound consulting session? So we would meet over a Zoom at a time that is convenient for both of us, and we would optimize healing. So a lot of times with chronic wounds, they can be very, very difficult to heal. So what I personally do is I take a full assessment of the wound. You would have to send me some pictures, so I can see the current wound. If you have previous pictures from either a month ago or so, I like to see those also. But what I do is I assess the wound. We go over my wound assessment. I ask you lots of questions, and then I create a plan that is going to work for you. Okay. So what does that mean? I look at all different aspects. Like I take everything into account. And even I've had some patients where they're just like, I have bowling on Wednesdays, and I know I need something more absorbent because I have a lot of drainage from the wound, but can we do something different for those, just 2 hours that I'm gone? And the answer is, of course we can. We'll come up with a plan that surrounds you. Okay. The main goal of wound healing is to make something that works for you, that you will continue to do. Optimize wound healing to get that wound healed. Because if we make a plan that you're really not on board with, or there's some reason that it makes it difficult to follow, whether it be supplies or money, no matter what it is, we can come up with a plan that fits you. Okay. I've worked with many people so far over the last year. And if that is you, I appreciate your support. I absolutely love helping people. And when I decided to go into the online space, I did this because I want to help more people than what I was before. I was working in a community setting, dealing with chronic wounds. So as a wound care specialist, you assess a wound and write orders for the other nurses to follow, to kind of unfold your plan of how to heal that wound. So that's exactly what I'm doing. And I work with you one-on-one to make sure that we do get healing out of your wound. Okay. Now, some wounds, there is some cases, and I will be completely honest with you in our sessions, if you have a wound that will not heal. Okay. I do get messages all the time about cancerous lesions, and that they've tried everything to heal these wounds. Unfortunately, cancer lesions are something that most of the time will not heal. I have had personal success with one or two of them, but it also takes time from a doctor removing certain parts. And that's something that we can talk about in our session. But I do just wanted to put that out there, that there is sometimes that there's just wounds that we can't heal. But for those wound management, we need to be managing them properly so they aren't getting larger. that's the goal. Manage the symptoms of these wounds. And it's really the goal of every wound. Manage symptoms and provide optimal healing potential. Okay, so that's really all that I have for this video. I just wanted to share with you that I do provide this service. I will put a link up here, or I think it's normally up here, and then I'll put it down in the description also. So that is all I have for today's video. I hope that this does help at least a few people. If you are looking for help with a wound that you cannot get closed, if you do not know what you should be using on the wound, I can definitely help you with that, and you can go to the link below and you can book with me. All right. Bye for now, guys. Have a wonderful day.